All right, good morning, everyone. We'll get things started here this morning with our program. Again, today we'll be reviewing Section 125 plans, also referred to as Cafeteria plans, and really meant to provide a basic overview of the programs, some of the requirements in terms of compliance requirements, participation, testing, which benefits are eligible. So we thank you very much for joining us this morning. If you have any questions, please feel free to utilize the application here and send a question our way. We'll do our best to answer them during the presentation, or we will also be taking note and responding to your questions after the fact later today or tomorrow. At the end of the presentation, I also will note an email where you can send questions off to us. It's info@benefitsqb.com. And again, we welcome your questions during the presentation here as well. So just real quick, a couple of slides in regard to ourselves here at Hampton Consulting and Benefits Quarterback. Just what we are not, I guess first I'd like to clear that. We're not a broker that's spreadsheeting existing carrier grids, really just transferring the information on canned programs to you in a different format. We're not what's often referred to as traditional 90-day partner. We're really looking to partner with our clients throughout the year, really being a resource for them throughout the process of implementing and administering comprehensive health and welfare programs. Not focused on amassing volume with an insurer or padding our own overrides or anything. Not a company focused only on our bottom line. We're really trying to be financial stewards of our clients' health and welfare programs and looking out for their best interests and the best interests of their employees. So having said that, what we are, privately held independent solution provider in the group benefits space. We are a team of individuals with varied backgrounds. I think it's fairly unique in this space in terms of the different experiences that we've all had, and it really brings a lot of different views and input to our client engagements. We are a firm implementing both traditional and some industry challenging solutions as well, looking to really help employers take control of their spend and their costs and understand the options available to them. And we're a partner taking comprehensive approach, really a three-pronged approach here with risk management, being the overall health and welfare program management, data management, so from an HR technology perspective, and then compliance, the key piece, the health and welfare compliance and all that's involved in that. Which is really the focus of today's presentation with regard to the Section 125 plans. So quick agenda here, an introduction to the cafeteria plans. We'll talk about the eligibility rules, qualified benefits, contributions and how they can be structured and what they look like, participant elections, and then some non-discrimination rules associated with the programs. So to start off, I guess, what is a cafeteria plan? Basically, it's a program that offers employees a choice between cash and certain qualified benefits. There are a number of different plan design options available, from the simple premium-only plan design to more complex flex plans, which is where the term cafeteria plan really originated. We'll talk a little bit more about that. So a key feature, and again, this will be a theme throughout, is that the key feature of these programs, it allows the employees to make the choice between taxable cash and non-taxable qualified benefits without any adverse tax consequences. So premium-only plans, an example of premium-only plan is the core cafeteria or Section 125 plan that allows employees to pay for their share of the qualified benefits on a pre-tax basis. So you're giving them the choice between taxable salary and the ability to make these elections on a pre-tax basis toward a benefit. Group health insurance being the most common qualified benefit may also allow employees to purchase benefits under a flexible spending account. So medical flexible spending account, dependent care accounts, etc. A full flex plan, so an example of a full flex plan, and I would say that these probably more common definitely in the late 80s and into the 90s. Less so today, but this is really where the term cafeteria plan originated. So a full flex plan is where an employer provided, let's say, a certain amount of money, $5,000, $8,000, whatever the amount may be, and then upfront at the end of the plan year, the individual had access to those funds, and then they were able to go through sort of a menu or sort of like a cafeteria. They were able to go through and select certain benefits and how they wanted to allocate the dollars that they were given by the employer to put towards those benefits. Certainly once that amount from the employer had been exceeded, then the employee had the ability to make their own contributions on a pre-tax basis towards benefits as well. So let's say the amount that the employer provided was enough to cover family coverage. So the employee would utilize the full amount provided by the employer, put it towards the cost of family medical coverage, and then they could use their own dollars on a pre-tax basis to purchase dental coverage or vision benefits or whatever the case may be, making an election towards the FSA. But that's really the concept behind a full flex benefit plan, often referred to as well as the defined contribution approach. So some of the tax advantages, obviously there's a salary reduction that's taking place, so you're reducing your taxable income as an employee, and you're therefore not going to be subject to federal income or employment taxes on the amounts that you've deferred. So there's an increase in take-home pay in that regard, that you're reducing the taxable liability. And then for the employer, they too are also having the benefit, receiving the benefit of a reduced tax liability, where they're not paying the 6.2% and 1.45% towards Medicare and Social Security. So there's a benefit for the employer as well. But again, as we mentioned at the beginning, the most important aspect of these programs is that there's a choice that the employee is able to make between the cash and the qualified benefits under the plan. And that's really what is at the foundation of these programs and providing the tax favored status, that choice. So some basic Section 125 requirements. First and foremost, a written plan document is going to be required. Every cafeteria plan must have a written plan document, and it needs to be formally adopted by the employer on or before the first day of the plan year. So it's a fairly straightforward process. Employers can, really just a one-page document where they're making that formal adoption. But again, that document is maintained by the employer, kept on file, and in case you ever needed to refer to it, you have the document there, just really supporting the ability to provide these benefits on a pre-tax basis. If there's no cafeteria plan document, there could be adverse tax consequences to the employer and the employees. They're fairly straightforward boilerplate documents. Some are more detailed than others, but the key is that you really need to have one if you're going to be offering benefits on a pre-tax basis like this. And benefits that are funded under the cafeteria plan, they may also need a plan document, but that's separate and distinct from this. So under ERISA, there's a requirement for employers to have a plan document specific to their health and welfare programs, but that is a different plan document. Oftentimes employers will have a wrap where they're including both the 125 document and the ERISA plan document together. But again, just separate requirements there. The contents of the plan document, I kind of touched on a little bit, but it's what you would expect, the basic information that's in there in terms of which benefits are available through the cafeteria plan, the participation rules, so who's able to participate in the program, the election procedures, when the open enrollment period is each year, contributions, who is making the contributions and the frequency, the maximum contribution for each benefit. So in some cases, there's going to be a maximum and a cap on there. The plan year itself is also defined, and then any specific provisions available for the benefit programs. Non-discrimination rules. Cafeteria plans also must pass 3 non-discrimination tests. So there's the eligibility test, the benefits and contributions test, and the key employee concentration. In a nutshell, basically, these tests are all really geared towards making sure that the highly compensated employees, that you're not really basically discriminating in favor of the highly compensated employees. And usually any administrator that you have working with you on the Section 125 plan or the flexible spending accounts can help you. And we have a number of third parties as well that we enlist for support with regard to the non-discrimination testing. From a reporting and disclosure perspective, Form 5500, there is no Form 5500 required for the Section 125 plan itself, although the separate ERISA benefits themselves under that are offered through the cafeteria plan or the Section 125 plan would be subject to reporting. And again, as you know, I'm sure any plan that has 100 or more enrolled at the beginning of the plan year is going to be required to fulfill their requirements on the 5500 filing. Disclosure, there is no participant disclosure requirements as well for the Section 125 plans, but there are disclosure requirements that apply to certain benefits offered, let's say, within the cafeteria plan. So, and usually, as you know, each employer is fulfilling those requirements at open enrollment annually or at various times of the year based on the requirement. So the eligibility rules, some of the rules regarding who can sponsor the programs. Really, any employer with employees subject to income tax can sponsor a cafeteria or a Section 125 plan. The private sector employers, obviously nonprofit, governmental partnerships, LLCs, sub-S. There are some unique requirements here specific to the partnerships in terms of who can participate. So only employees can participate in the cafeteria plan, employees and their covered dependents. And that includes current and former employees. In some unique circumstances, COBRA beneficiaries, where let's say an individual may be in a severance situation and still receiving payments from the employer, they could potentially participate in the program. But generally, we're talking about your active employee population here and their covered dependents. Does not include self-employed individuals, so partners in a partnership could not participate in the program, and non-employee directors can also not participate. Just important to note, the Section 125 codes treats more than 2% owners of a sub-S corp as partners. So those individuals also could not participate in the 125 plan. Coverage is available for spouses and dependents. You can only offer the qualified benefits to employees, their spouse and dependent children, or their tax dependents. So we have a brief definition noted there of each. In terms of the dependent children, just as everyone's aware, I'm sure, with the Affordable Care Act, we have coverage offered to age 26 under the medical plan. And it looks like for a dependent child, obviously, you could still have them participating or benefiting from your, let's say, your medical FSA election up to age 27. So just a slight distinction there between the ACA and the requirements here. In terms of the qualified benefits themselves that can be offered, so most commonly, everyone's familiar with the medical plans being offered. So regardless of plan design, you can have an HMO, PPO, high deductible health plan, point of service, whatever the case may be. Those programs and the contributions associated with them are all eligible, considered qualified benefits through a cafeteria plan. Adoption assistance benefits, dental, disability, health FSA, health HSA, sorry, we have a typo there, it always recorrects for the health savings accounts, but it's an HSA. Group term life, one point to note in regard to the life insurance benefits, oftentimes employers will not have them offered through the 125 plan because it subjects you to some additional requirements from a reporting perspective, and you can get into a situation where there's a need to report imputed income and do some calculations. So administratively, we often see employers having the contributions for the term life, the voluntary term life, outside of the 125 plan. Some of the benefits that are non-qualified and cannot be offered, so educational assistance programs, health reimbursement arrangements where it's purely employer dollars involved, spouse life insurance, long-term care, pet insurance, all those different benefits you see listed there, not eligible through the cafeteria plan. So in terms of the contributions themselves, what sort of contributions can be made under the programs? Cafeteria plan benefits can be funded in a variety of ways. So either employee contributions or employer, and most often we're seeing a mixture of both. So there, whereas the employer is making certain contributions towards the benefits, oftentimes they may make a contribution to a health savings account on behalf of the employee, or even to the flexible spending accounts for the employee. And then the employee obviously makes the election themselves as well to reduce their salary on a pre-tax benefits and on a pre-tax basis, and pay for their benefits. So the employer can do it in a number of ways, as I mentioned, matching contributions, some of the flex credits we talked about, or a fixed amount for a specific benefit. Like in the case of a health savings account, if you're offering a high deductible, a qualified high deductible plan, and the employer is making, let's say, $1,000 contribution to the health savings account, on a pre-tax basis. The amount of contribution, it can really vary from benefit to benefit based on plan design preferences. So there could be a certain amount allocated towards one type of medical plan and another amount towards a different medical plan, all based on the structure of the contributions. Dental as well, obviously differing contributions there. Some cases there are legal restrictions for benefits, such as health FSAs, where the IRS is on an annual basis kind of dictating the maximum benefit that can be elected for both the medical FSA and the dependent care FSAs. At one point, medical FSAs really had no limit, but as we all know, in recent years and with the advent of some of the legislation now, there's required caps on those benefits. And it can vary for different groups of employees, but the concern there, you just want to make sure that you're not running afoul of any of the non-discrimination rules if you're varying your contributions or allowing differing contributions based on groups of employees or different classes of employees. So cash out provisions, and again, this goes back to maybe I'd say the initial cafeteria plans when they were, or the defined contribution approaches where the employer was giving you that bucket of dollars at the start of the plan year and then to go ahead and make your elections. If employees made their elections and then they ended up having dollars left over from the employer, let's say, like I said, the employer gave you that bucket of $5,000 or $8,000, and maybe your benefit elections only ended up being $6,000 for the year. Oftentimes the plan would give an option to have a cash out where you could then take those remaining dollars in the form of cash. But it's important to note that any cash in lieu of benefit is always going to be a taxable event to the individual. I know some arrangements, we had one employer who allowed people to cash out, but it was on a 50% basis. So let's say you had $1,000 left in your benefits available to you through the cafeteria plan, you had a maximum cash out of $500 available. Not as common anymore that we're really seeing employers offering the cash out option. And again, those true quote unquote, cafeteria or defined contribution plans aren't as common as well. That may change in the future. We may see them making a comeback as we get more consumerism in terms of benefits offered, where people are really going and picking and choosing and customizing their benefit programs. I could see employers making a move back towards that arrangement, but currently the concept of real defined contribution and cash out isn't as common. And there are some things we list here that you really want to be aware of as well if you are offering that cash out option. So under the Affordable Care Act, you can't condition the receipt of any sort of cash out based on the purchase of an individual policy, outside of the group health and welfare group medical program. It can impact the affordability calculation as well for applicable large employers. And I won't get too in the weeds on it, but there are just some subtle differences there, and it's important to make sure that you structure the cash out appropriately so that it's not impacting that affordability calculation. And then certainly, from a Medicare secondary payer situation, you don't want to be offering a cash out incentive in such a way that you're really enticing individuals who may be Medicare eligible to waive the benefit program and instead opt for a Medicare supplement when they are truly eligible for the group medical program as well. So just some things you want to be thinking about and be aware of if you're going to go with that cash out offering. So participant elections under the cafeteria plans in Section 125. General rules here in terms of the timing, the elections need to be made in advance of the plan year and not really on a retroactive basis, so a prospective basis. There needs to be an annual enrollment period, and it needs to be well communicated and documented. The mid-year enrollment window for new hires is permitted, and there are certain mid-year election changes that are allowed, and we'll go over that in the following slides here. The elections themselves really need to be voluntary in nature, and they need to be making the choice, as we said, between the taxable benefit and qualified benefits. So some employers are also giving individuals the choice between pre-tax and after-tax. So specifically there, I'm thinking of the example of disability benefits. Employers can structure their programs where individuals have a choice to make the contribution on a pre-tax or a post-tax basis, and that can impact the taxability of the benefit. So again, some individuals really, I know some employers offer that program, and it's well received by employees. They want to get a non-taxed disability benefit if they have the ability to do so. So some of the types of elections you can make, there are really three main types: it's affirmative, automatic, and rolling. So the affirmative elections, it's probably the most common, where the employees are making a choice each year to either enroll in the benefits or waive the benefits, and then change their elections from year to year. So move from one plan to another. Maybe they're in the HMO this year, they decide they want to be in the high deductible next year. Automatic elections, where it's really automatic enrollment. So employees who don't want to participate, they really have to make sort of that positive election to waive. Otherwise, the employer might automatically enroll everybody in like the basic medical plan, single coverage. But the employer in those situations really needs to provide adequate notice to the employees that that's the structure that they're utilizing and the approach that they'll be taking. And then rolling elections, where your election that you make this year, it's just going to automatically roll next year through open enrollment. But it's not as popular with full flex plans, really not recommended, just because you're talking about a real deferral there that the employee is making towards the medical FSA or the dependent care account, and you really want people to be making those elections on an annual basis, since we're talking about reductions in salary on a pre-tax basis. But again, that's one common approach too, where employers will say, specific to the medical oftentimes, or dental, where your elections will just roll into the next plan year. But you have an option here as an employer to really choose the method that you want to utilize, and obviously it's going to be a decision that you make based on a number of factors: the plan design that you have, the number of options offered, the employer preference, workforce demographics, what's going to make sense for your population. So a number of factors go into the decision, but you do have options there in terms of the way you want to facilitate the elections. The elections are irrevocable, so participants' elections they're locked in really for the plan year, and that goes toward the IRS requirements here and the benefits that individuals are receiving from a tax-favored perspective. So that is one of the requirements, that basically once you make the election, you're going to be locked in for the plan year. There are certain exceptions where you can make mid-year election changes, and the employer can also structure the plan. You have some leeway there in terms of which mid-year elections you're going to allow. Certain ones are required, such as the HIPAA mid-year election changes, special enrollment, and special election changes. But there is some leeway that you have as well as an employer when you're kind of drafting your plan document. And most employers do design their plans to allow mid-year election changes permitted by the IRS. You don't really want to get into a situation where employees have an issue and they need to make a change in their benefit and not able to do so. So the IRS recognizes three really broad categories of mid-year election changes. There's a change in status, which they refer to as major life events. You see them listed there: marriage, birth, adoption, employment changes, marriage, birth, adoption. Those are all addressed through the HIPAA requirements as well too. But cost or care coverage, so changes to qualified benefits under the Cafeteria plan. The cost one it's been sort of a gray area a little bit in terms of how they define those changes, and then other laws or court orders. So criteria that or Cafeteria plans with subject to HIPAA, COBRA, ACA. There are certain requirements in regard to those programs as well. The general rules for changes in mid-year elections: an employee to be eligible to change his or her election during the plan year, they have to experience one of those mid-year election events recognized by the IRS. The Cafeteria plan document has to permit those elections, and then for a change in status events, the requested election change really needs to be consistent with the change in status event. So there are certain plan changes, and we have a number of documents that we can provide. If anybody needs more information, just reach out to us after. But we have some documents that really do a nice job of going into detail and explaining the difference between the HIPAA mid-year election changes and the regular qualified IRS 125 Cafeteria plan changes. And then we'll touch on that here in the following slide as well too. So some of the change in status events: change in marital status, change in the number of dependents, change in employment status, residence, So these are all the major life events that can impact your eligibility and allow you to make those mid-year elections and mid-year changes. Cost changes, again, this one, cost changes can be automatic, so you can automatically increase or decrease the employee's contributions. If the cost of the benefit changes during the period of coverage, the employees are required to make a corresponding change in their payments as well too. Really uncommon. I can't say that I've ever really encountered it, just because employers and ourselves, we're really working very hard at the beginning of the plan year to nail down all the costs and make sure that there's no ever situation where there would be a need for things to change during the plan year. But those rights are in there, and that you do have the ability to do that. Significant cost changes from the employee election. So you could also commit mid-year election if the cost charged to an employee significantly increases or decreases. And the gray area there is the word significantly. It's never really clearly defined in terms of how much of a percentage increase, in cost or decrease in cost, or or dollar amount or anything along those lines. So it's a little bit open to interpretation. But again, mid-year changes in terms of these type are very rare. I'd say certainly, obviously, you have situations where people are adding dependents or getting married and whatnot, but the impact of cost is usually nominal during the plan year. Some other coverage changes, significant curtailment of coverage, additional improvement of benefit package. So if something new were offered mid-year, again, a lot of these are not as common. Maybe the more common would be the last two here, where it's the change in coverage for spouse or the loss of certain other group coverage, and that includes CHIP or Medicaid or Medicare. If an individual lost coverage for those benefits during the plan year, or if they were covered by their spouse's plan, let's say, and for some reason lost that coverage mid-year, those would be situations where you could allow a mid-year change or a mid-year enrollment in benefit. And then we just list here some other court laws and orders, court orders really, that would require the ability to make changes in elections. So we won't go through all of them. Specific to the Affordable Care Act, there were some requirements under the cafeteria plans where changes would be allowed. So the exchange enrollment, if the employee wanted to end their coverage and enroll in the exchange, that would be a situation where you could allow mid-year election, and again, really specific to the Affordable Care Act. And then a reduction in hours of service. So let's say the employee's hours are reduced to fewer than 30, where they wouldn't necessarily be a full-time employee, but that reduction in hours didn't affect their eligibility. So let's say that they were still within their stability period for a number of months. But now, based on the hours that they're working, they're not making enough money to really cover the cost of the benefit or their required contribution. So even though they might be eligible to remain in the benefit for a number of months, they're really not able to do so from a cost perspective. So situation where you would allow the ability to make a change in benefit or disenroll from the medical program. Some special rules in regard to the plans. Only some of the mid-year election changes apply to the health flexible spending accounts. To changing status events apply. So where there's a marriage or birth of a child, you could make changes in your election and increase, let's say, your flexible spending account election, or add a dependent care account. But situations such as the cost and coverage changes don't apply, and the ACA changes don't apply to the flexible spending accounts. Employees can prospectively change their health savings account contribution really at any time during the plan year. The only differences or requirement there is it can be subject to some employers' administrative requirements on that, but you have the ability to make those changes really at any point during the plan year. So a couple of quick slides here on the non-discrimination rules before we wrap things up. I appreciate everybody being with us this morning. There are three main tests really. The eligibility test, a sufficient number of non-highly compensated individuals must be eligible to participate in the plan. Again, we're not favoring towards the highly compensated individuals. The benefits and contribution test, and then the key employee concentration test. So, and they're really looking just to make sure that the contributions and benefits are available on a non-discriminatory basis. You're really, again, not favoring a particular class, specifically highly compensated individuals. And the key employee contributions cannot exceed 25% of the total. So with regard to these programs, I will say that they're complex. Most employers definitely utilize outside services, outside providers, I should say, to perform the tests. We have a number of different partners who are able to help us with the testing for our clients. Testing really should be performed each plan year, and we really try to encourage employers to have the testing done early on after the start of the plan year, because if there are adjustments that need to be made as a result of let's say looking at that key employee contribution, if we have more than 25% of the total contributions coming from key employees, there's some adjustments that are going to need to be made to the elections. And it's much better to have the dialogue with individuals early on in the plan year before significant dollars have been allocated to the benefit and their tax implications. So again, we really recommend and encourage employers to do the testing early on in the plan year and then make any necessary adjustments as a result. Simple cafeteria plans, they're safe harbor plan design for small employers. That's really considered employers 100 or fewer. And I have more information on the simple cafeteria plans too, if this is applicable to anybody. We can get you a nice overview in regard to these programs, but the basic requirements that, from an eligibility, the employer contribution, and then the design, there are key elements there that would allow you to offer what's considered this simple cafeteria plan based on that safe harbor design. So some separate non-discrimination tests, just really before we wrap things up here. Additional non-discrimination tests, and we talked about the ones for the cafeteria plan, but the Health FSA has its own non-discrimination testing under Section 105, and the group term life insurance, I alluded to it, I think, during the slides before with Code 79 and the potential for imputed income calculations. So those non-discrimination rules, a lot of times they're addressed as well as part of the Section 125 testing, the non-discrimination component of it. And then dependent care accounts have their own non-discrimination rules and testing as well under Section 125. So again, we have a number of partners who are able to assist in regard to all the testing, but important to be aware of as an employer and a sponsor of these programs that these are tests that definitely should be conducted on an annual basis. So that really wraps it up for us this morning. Again, if there are any questions, we're happy to answer them. Some of the ones that we're going to be taking back, and we'll be shooting an email back to you. But if no one has any questions at this point in time, we really appreciate your time this morning. And certainly, if there's any information that we provided today that you would like more information on or a deeper dive, please feel free to reach out to us at info@benefitsqb.com. And we will be happy to get that information right over to you. So again, thank you everyone for your time today, and have a great rest of your day. Take care.